In this video, I'll be talking about travel and breast cancer. Travel is one of the best things in life, and if you have plans already made and then bam, you get hit with breast cancer, you're probably wondering, how am I going to make this work? Or you travel for work, or you go to two different places for your care. You might live in New York and get your treatment in Florida. So, what do you need to know to be safe when you travel? Because safety is really the big thing. One thing to know is travel is not contraindicated. You can travel during treatment for breast cancer. There are some cancers where the bone marrow, the body's immune system is so suppressed that we don't recommend it. But breast cancer, that's not the case. So, traveling during breast cancer, let's start with talking about surgery. In general, we recommend that people don't travel for the first couple weeks after surgery by plane. You can travel by car, you could travel by train, you can travel, by boat, but we don't want you too far away from the surgeon. There are really common things that happen, like a fluid collection that might benefit from being drained, and it's nice to have that care delivered by your own medical team. Does that mean you can't travel and get that taken care of elsewhere? Absolutely not, but it just adds a little more drama to your life. So, one thing you might want to consider is if you have a trip booked and you're facing surgery, is seeing if you can start other treatment before you go on your trip, if it can't be rearranged with ease. But a lot of my patients have postponed a trip, or another option, as I mentioned, is to start chemotherapy before you go on a trip, and then just time the chemotherapy right so that your bone marrow has recovered. I do this to indicate your white cell count is coming up as you go on your trip. Then you come back and get your next chemotherapy treatment. And surgery would be after chemotherapy. In that case, there is no disadvantage to doing that. And actually, there are some advantages. You shrink the tumor and make the surgery a little less extensive. If chemotherapy is not part of your plan and you're going to be getting surgery followed by radiation therapy, again, just wait a couple weeks and then go on your trip and then return and start radiation therapy. We do not recommend taking a break in the middle of radiation therapy. These sort of delays, even of 5 days that aren't due to side effects, are associated with less benefit than to the radiation. So you're getting all this radiation and you're going to benefit less if you stop in the middle because of a trip or other travel that you have planned. And it's also really hard to start radiation in one place and finish in another. In fact, I've never seen it done because the machines are different, and you really want the physicist and the doctor who did your treatment plan to be the one to carry it out. Okay, so surgery, we say wait a couple weeks. Radiation, wait to start until you're back and you can be back for 6 weeks, or a shorter course of radiation if you're getting a short course of radiation. What about chemotherapy? As I mentioned, you can travel during chemotherapy, though a lot of people don't feel comfortable traveling overseas. That makes a lot of sense if you're traveling to a place where the medical system is not one that you're comfortable with. You may not feel as safe. If you're traveling to a place let's say you have family in another country and they're familiar with the healthcare system, that's probably not a problem. If you're traveling within the States, much less complicated. If you're traveling for work, just make sure you get a lot of rest during chemotherapy. And even if you've just finished surgery and radiation, those can really wipe you out. So you want to dial back your expectations for how many hours you can work or how many hours you can play and how much rest you need. Just listen to your body and don't try to be a warrior. You are already being a warrior. You're really going through something pretty extraordinary. One of the things people ask about when they travel is lymphedema, and I'm touching my arm because lymphedema can lead to swelling of the hand, the arm, or the chest wall. We used to give everybody a sleeve when they traveled over 30,000 feet, sort of an elastic sleeve, but lots of people have traveled without and had no problems. So if you're given the sleeve, take it with you, and you can wear it if you want to. One thing that will do is let other people know that helping you with your luggage is really helpful, because very few surgeons are going to want their patients lifting something very heavy like your bag over your head. Get luggage with wheels, for example. See if you can have other people help you with your luggage. So the sleeve is kind of nice. It's a reminder to you and the people traveling with you and other people on the plane to signal, here's this person looking well, but they can't lift their bag. It may help prevent lymphedema, but if you're on a flight and it starts to feel uncomfortable, you don't need to keep it on. You can take it off without risking your health. Lymphedema is quite uncommon, but for those who get it, it's a serious complication, and we don't want to play fast and loose with it. We don't want to be cavalier about lymphedema. So until you've been cleared to lift weights and increase your strength, hold off on those heavy bags. Get help that you need. Consider the sleeve. If you aren't offered a sleeve, let's say you just traveled and nobody offered you a sleeve, unless you have problems with swelling, it caused you no harm. Lymphedema can occur at any point after surgery on the lymph nodes, so don't throw away that sleeve. You may want to keep it for subsequent trips, but lots of my patients don't use them anymore, but almost all of them travel with their sleeve. Otherwise, make sure the medications you take with you that you have enough. So if you're going for 4 days, don't take 4 days of your anti-estrogen therapy. I would recommend you take as many as 12. You're going to drop a pill. You're going to have travel delays. And this is one way to make sure you don't have travel delays, is to magically take extra pills and somehow it wards off those delays. Mostly I'm kidding, but it seems like the more prepared we are for something, the less likely it is to happen. I hope this has been useful. Travel is such an important part of our lives. If you're traveling for work and you don't want to, really important thing to talk to your employer about. But new sights, new people, new scenery can be really helpful. If this video has been helpful for you, click like. That helps other people who are thinking about traveling during breast cancer and its treatment find it. And click subscribe, because we're always creating new videos. You can also put a comment or a question below, ideas for future videos. I've got a list of ones we're in the process of making. And you can also follow us on Instagram. Thanks for watching.